Hey everyone, this is State Representative Daniel Hernandez from LD2, and
This is State Representative Alma Hernandez from LD3.
we are really excited to be able to do this today. Obviously, during this crisis, we've had to adjust how we communicate with folks. So what we're doing is in order to try and inform our legislative districts and our communities about some of the really important updates that we have to share, we wanted to bring on a special guest for our first interview. That's going to be my friend Nico, who came to shadow me at the legislative session earlier this year. So I'll hand it off to Nico to tell us who he is and what he does for a living. Nico?
Hi guys, well thank you both for having me. My name is Nico Latini. I'm the president of the Old Pueblo Firefighters Association. I represent 130 firefighters in Pima County, which is the suburbs of Tucson, Arizona.
Perfect. So Nico, we are seeing a lot of interesting things happen right now. There's a lot of misinformation and a lot of information that's coming at people all the time. We're seeing a lot of really concerning things coming out of some of the hardest hit areas like New York City. So what does a day-to-day look like right now for you during the COVID-19 crisis as a firefighter and as a member of the Old Pueblo Firefighters Association?
That's a great question. So it's funny. You would think that this would probably be something that all firefighters would do every day anyways, and it takes something like this to reinforce that. But for me, I'm an engineer with our department, so my responsibility is the fire truck, obviously. When I get to work in the morning, one of the first things that I do is I go out to the truck, put my gear on the truck, and I go over all the bigger mechanics of the truck, make sure the brakes are in order, the pump is working, I've got pressure on my tires, those kind of things. That's usually what all engineers do first thing in the morning. For me, what I've been doing for the last 2 weeks now is I spend the entire fire truck. So I will go out there with, whatever cleaners and stuff that we have, and anything that you could possibly think of that hands are touching, I decon it. There's 18 firefighters that work at my fire station. 6 are on every day, but there's 18 of us that rotate. When you start talking about social distancing, that's far past that number, right? In addition to that, we are going and running calls on sick people and people that are potentially COVID positive or are asymptomatic, and we don't even know that. And all those germs are coming back to the fire truck with us and then back to the station. So I spend the first hour of my day deconning the entire fire truck, and then I go inside and I decon not only my bunk room, but the station. And the rest of the firefighters, obviously, they help with that, right? It's not just me by myself. But we spend an hour to 2 hours every morning deconning everything from what the last 6 guys were just doing for the last 24 hours, right? So that's kind of how my day starts every day when I walk into the fire station.
Yeah, and I think one of the things that you and I have talked about is personal protective equipment. And usually when we are not in the middle of a crisis like we are right now, it's fairly easy to get things like gloves and masks, and you have to just make sure that they're in stock. We're seeing shortages all over the country and all over Pima County. Has that had an impact yet on the work that you do when you go out the shortage or potential shortage of personal protective equipment as a firefighter?
It has, and that's another thing that you don't think about on a daily basis, right? You go to work and you expect that the equipment and the tools that you need to perform your job, keep yourself safe, keep the public safe are there. We've been advised when this first started, hey guys, listen, nobody panic, right? Don't everybody overreact to this. Wear the appropriate PPE for every call. And like I spoke about earlier, you would think that you'd come in and decon everything anyways. What really is appropriate PPE? I would almost say it'd be appropriate to wear an N95 when you go on a call, just regardless of a COVID-19 outbreak, because you're usually running on sick people. You don't want to be breathing what the particulates that they're putting out, right? So we've been told, hey, don't wear N95s on every single call because of that shortage. We're going to run out. Wear a surgical mask right now. The CDC says that the surgical masks are okay. The International Association of Firefighters are suggesting that firefighters wear surgical masks while they're just in the station, let alone on calls. So our chief has put out a mandate saying, don't wear an N95 on every single call. Reuse the N95s that you are using if it's not a suspected or positive COVID patient. We only wear a gown and sleeves if the update gives us droplet precautions that we're supposed to be taking into consideration. So something that you would think, hey, me personally as a union president, I want our firefighters to be protected 100% of the time. And so I'm in a tough spot because I'm a advocate for telling the firefighters wear all the PPE on every single call, because we don't know. You honestly don't know what you're walking into. Our dispatchers can only get the information that the calling party is giving to them. Sometimes the calling party is not even there. It's a third party caller, or they just don't know. And we walk into a situation, and we've had plenty of firefighters throughout the country that have contracted COVID-19 and have tested positive because they're running calls where they didn't have those precautions up front. Maybe the patient didn't even know that they were positive. Now you're dealing with sick people.
And that's the big thing. We don't know, but because of lack of testing, not just in Arizona, but around the country, there are plenty of people who may be sick and spreading it to those who are more vulnerable and not even know it. Alma, I think you had a question for Nico.
Yeah, Nico, thanks again for joining us today, and so that we can put this out to the public and especially our constituents so they know what's going on with those who are in the front line right now, are people who are putting their lives really on the line, as you always do, to help everybody else in the community. And we're constantly asking people to do their part, to social distance, to stay home, and it's a sacrifice that we're all making. I'm currently sitting here in Phoenix, still stuck here for a few more days, unfortunately. I would much rather be home with my family, but because my father, as I mentioned before, is elder and is on oxygen 24/7, has a bunch of other health issues, it wouldn't be responsible of me to go home after being at the Capitol around so many people. So what is it that you could recommend for those of those that are watching right now, instead of having to call or go straight to the emergency room? What would you recommend that they do in order to ensure that we're keeping you all safe, but we're also, not spreading COVID around the community?
Wow, that's a tough question, right? The first thing I would recommend is take a deep breath, right? I think all of us, as a human race, we need to take a deep breath, take a step back. This is a very scary situation, and I'm not trying to downplay it at all, because this is real. People are dying. This is real. But take a deep breath and think, do I really need to be calling 911 right now? And in no way, shape, or form am I advocating that somebody does not call 911. Please, by all means, if you are having an emergency, you call 911. That is what we are there for, and we will be there. What I'm asking is for people to consider, are they having a true medical emergency, right? Is this something you need to go to an emergency room and see an emergency room doctor for? Or is this something that you could pick up the phone, call your primary care physician, right? Call 211. And maybe this is something that, even if you're sick, you shouldn't be going to an emergency room if you're sick. You go to the emergency room when you're having an emergency, when you're dying, when you're having a traumatic event, right? So I would ask the residents of Pima County, where we work, is to think about, is the hospital the right place for you? Because that's where all the truly sick people are, right? Especially the elderly community that is so susceptible to coming down with any of these things, right? COVID-19 is at the hospital. That's the last place I would want my parents, my grandparents to be, unless they truly needed to be in an emergency room, right? So in no way am I advocating to not call. I'm not trying to deter people from calling. Please call 911 if that's what's appropriate and that's what you need to do. But you got to understand that when you call 911, you're sending an entire crew of first responders to your house. We are using the PPE that we're running extremely low on. Us as first responders, we might be asymptomatic and be carriers of this right now. And now we're coming into your home and we're potentially exposing you and your entire family. And we don't know that, you don't know that, right? Or you could be a carrier and this isn't truly an emergency. And now you're exposing all the first responders that are coming to your house as well, right? So I just recommend that people take a deep breath and think about the actions that they're taking and what that means to everybody around them.
Yeah, Nico, and I know we briefly talked about this, and thank you again for mentioning some of the things people could do in order to minimize, the burden on our healthcare professionals. But also, can you tell us like the do's and don'ts as far as calls go to your department, especially? I'm seeing a lot of people on social media who are very scared, and yes, rightfully so. There are people who are worried, and I completely understand. And I, as a public health professional, try and encourage everyone to do their part, right? But what are the do's and don'ts as far as calls that you've basically been seeing this past week, and how you would ask the public? How would you ask the public, in other words, to make sure not only that they're thinking about it before they call, but what are some examples, just so that people get an idea of calls that are, ones that are actually emergencies and some that are not, that you are going to the front lines and working and dealing with?
Sure. Well, I mean, with HIPAA and stuff, I got to be very careful about what I talk about, what the do's and don'ts are. But again, common sense, right? You know, humans we're an intelligent species, right? You know, and a lot of people, they'll call 911 because it's convenient, right? And that's the worst reason to call 911, right? I'll say I'm not an advocate for telling people don't call 911, but you definitely don't call 911 because it's convenient, because you don't want to sit in an ER lobby and wait. I can't tell you how many times we show up to somebody's house and they say, well, I don't want to wait in the lobby, and I know if I call an ambulance, I just get straight in. That couldn't be further from the truth. Everybody is triaged at the hospital. If you are shot in the chest and you're able to drive yourself to the hospital, or your family drives you to the hospital, and you go in through the front door, I can assure you, you're not waiting in the lobby. You're going straight to the back to an ER room, into an operating room, right? It's no faster as if we took you in by ambulance. On the flip side of that, if you just, maybe you have a cold, or you have a stomach ache, and you want to go see a doctor, and you don't want to have to wait in the lobby, so you call 911 and we take you in by an ambulance, I can assure you, unless there's an empty room and the hospital's slow, which is far from the truth right now, you're going to go sit in the lobby for hours, right? So an ambulance doesn't mean that you're getting in quicker and that you're getting out any quicker. But I'll give you an example. Very recently, we ran on a intoxicated patient who had fallen down, and there was no injury. The person didn't need any kind of medical attention whatsoever. That person's spouse had, they were also intoxicated and overreacted and called 911. And we were happy to show up, but that definitely wasn't the best use of the 911 system. And you now have 6 firefighters coming into that home, potentially exposing them to everything that we have, or vice versa, right? So, and that's just an example. And again, I encourage everybody to call 911 if you think that you're having an emergency, right? You're not a doctor. I understand that. So if you think you need help, that's what we're here for. But again, you are taxing the system. You're asking us to use PPE that we could be using on the next emergency if we need to.
Great. Thank you, Nico. I appreciate that.
So Nico, I think now there is an emphasis on making sure that our first responders are being taken care of. One of the big issues that we talked about this last session was the exposure that you all have as firefighters when you go on the job and try and protect people in our communities. Can you talk a little bit about some of the stuff that was going on this legislative session prior to COVID-19, and kind of how it kind of dovetails into what's going on now, where people are more aware of the risk that you all are taking each and every single day by going into dangerous situations?
Sure. Well, I think the one of the hot topics in the legislature for firefighters is the presumptive cancer law that Senator Carter and Senator Boyer, are champions for, and I know both of you are champions for us as well on this. But first responders, our military, our fire, our police. I'll say, 3 of the most honorable professions in the world, right? All 3, military, fire, police. We sign up to put our lives in danger every single day to save the public, to protect our freedoms as human beings. And with that comes risks. And some of those risks are things that we have really no control over. And as much as we train and as much as we've got protective equipment to protect ourselves from these risks, some of them happen anyways. And cancer is one of those things that has been proven by science that firefighters contract cancer at a much higher rate than the regular public does. And luckily for the firefighters, we've had a lot of champions in the legislature that have been pushing this laws through that will take care of us and make sure that the insurance companies and the municipalities and the districts and the departments that we work for take care of the firefighters that unfortunately contract this illness, right? So we're trying to push that cancer law through. There's some hangups because of it, unfortunately, to dovetail that into the COVID-19, and I think we're going to get there with the cancer stuff. I truly do believe that we are. But some of those same insurance companies came out immediately when the COVID-19 stuff started happening, saying, you know what, we're not going to cover that. I don't really know what to say to that. I don't know how to respond to that other than shame on you, right? And this isn't an anti-insurance company statement, but the insurance companies are in business to provide insurance to people, right? It's not to sit there and just make profits, right? What would be the use of an insurance company if they never had to pay for any of the compensation that the people need, right? So that's silly. That'd be like your car insurance company dropping you if you get an accident, or saying, you know what, we are not going to cover any car accidents if a vehicle's moving. Well, that's how we get in a car accident. They're moving, right? So it's just that simple. And I believe a lot of the COVID-19 stuff's been corrected. And some of those insurance companies that originally came forward and saying they weren't going to cover retracted those statements. But moving forward, and I'm glad to call the two of you, champions for firefighters. And I believe that both of you, along with a lot of our other friends at the state capitol, will work on things like that and look at issues that come down the pipe towards us and say, you know what, we have to take care of our first responders. We need to pass these bills and make sure that those who sign up to take care of us are being taken care of if something bad happens,
Yeah. Thank you so much, Nico. It's been really wonderful to get you on. I know you're busy and you're tired because you just worked fairly late. But I think for folks to understand kind of what's happening on the ground with first responders, we just saw news out of New York and Detroit where firefighters and police officers are testing positive and some of them even dying. And you guys put your life on the line every day normally. But I think now folks are starting to become more cognizant of the fact that this is happening each and every single day with the work that you're doing. So thank you so much. Is there anything else that you think would be important for folks to know as we wrap up this little interview with you?
Actually, I want to touch on something that Alma had said, right? We all have elderly parents or young children at home, and family, friends that we care about, right? And we are in this together. This isn't Pima County or Arizona. This isn't even America. This is the world, right? The human race. We have the ability to stop this from spreading. And all we have to do is think about other people instead of ourselves for just a very short period of time. If everybody stays home, unless there's a necessity to leave, right? If everybody stays home and we stop spreading this around, we will flatten that curve, right? But it takes 100% of us to participate and say, you know what, I'm a young, healthy male, and I understand that. And the chances of me outside of what I do for a living contracting COVID-19 are minimal to none if I just wash my hands, wear a mask, and take those precautions and stay inside. But my parents and my grandparents, they're elderly. They are susceptible to this illness much faster than us, and they won't recover the same that I would, right? So I haven't seen my family in going on 3 weeks now. That's tough. It's my sister's birthday. Happy birthday, Michelle, by the way. It's my sister. I would love to be spending time with my family, especially today. And we're not doing that because it's a responsible thing to do. So I ask anybody that's watching this, residents of Pima County, the state of Arizona, the United States, and around the world, please, let's flatten that curve. Everybody be respectful of each other and understand this is not about you. This is about all of us. Life, liberty, and the pursuit of happiness, right? And people are thinking, well, my liberty and my pursuit of happiness is infringed upon. Well, what was the first thing I said? Life, right? If you don't have a life, then there's no liberty or pursuit of happiness. So we need to take care of each other. We don't need any more people dying. Unfortunately, what are we up to? 2,500 cases, 65 deaths in Arizona as of this morning. That's 65 too many people that have lost their life.
Right. Well, Nico, again, thank you so much for all the work that you do to keep us safe down in Pima County. We'll be in touch as things progress. But I think the last thing that we wanted to reinforce is what you said, which is if anybody has an issue, try 211 as your first line of defense. If it's not an emergency, call your primary care physician, do a phone call with the nurse. A lot of doc on demands now, trying to make sure that we are keeping folks away from the emergency room where they might be exposed to something even worse than what they have. So not discouraging folks from using firefighters and EMTs, but saying, let's be really careful and thoughtful about how we're doing this to not create a burden on the system that's already going to be very burdened. So thank you so much, Nico. Alma, any last thoughts?
Yeah, just one quick thing. And now that we're mentioning calling 211, if they have any questions or need any services, anyone could call 211 and it's up and running now. They have all the resources available. But I would also encourage people to visit the Arizona Together website. Arizona Together is a website that Governor Ducey has put out that has every list of resource from housing, food assistance, anything that is needed really because of the crisis that we're facing. You can access all of that information using that website, and that's arizonatogether.com. So I encourage those who do have questions or want to learn more about what the state is doing, what we are doing, to go and visit that website. And again, thank you so much, Nico. We appreciate it. Stay safe and healthy, and we hope to talk to you soon. Thank you.
Thank both of you.
Bye.
Bye.